Welcome to the Future State of Business, presented by Samsung Insights. I'm Andrea Rains from the Samsung Mobile B2B team. Each episode, our head of Mobile B2B, Taher Bebahani, and I will sit down with industry experts to discuss what's next in enterprise, education, healthcare, and more. On this episode, we're joined by Neal Reizer from Homecare Homebase, a leading software solution for home-based care. Home health and hospice care providers use the company's software to manage scheduling, billing, compliance, and more. Neal talks to us about how home-based care has evolved during the pandemic and what these changes could mean for healthcare delivery long-term.
Hi, Neal. How are you?
I'm good. Good. How are you?
Good, thank you. Thanks for taking time.
It is my pleasure.
Tell us what's going on with your business and how essentially your business has changed in the past 6 months, given the pandemic and what's been going on in the marketplace.
The business model itself in home health and hospice is delivery of the care in the home, which is where patients want to be seen. It's a lower cost venue and you can get tremendous quality outcomes. COVID had a dramatic impact on our customers. Our customers are the ones that are out in the front lines servicing the patients. And almost immediately, what we saw was a dramatic drop in the number of visits being made for two reasons, primarily. One is patients didn't want anybody in their home, rightly so. And secondly, even those that did want people in their home, you had a lot of clinical staff that had exposed and had to quarantine, et cetera. So for a good month or two, you had a dynamic where a lot of the visits had dropped. There was a real uptake in virtual visits that really was a mad scramble to begin to understand how you could supplement in-person physical visits with virtual visits. And then over the last probably 2 or 3 months, I think things have started to level back off. Hospice, we've seen a little bit less in terms of the rebound. There's still quite a bit of concern about letting people into these residential facilities where some amount of hospice is practiced.
Neal, with some of your customers looking at their productivity, using your technology, do you think that they are more productive when they're going into homes and things like that? Are they trying to be more efficient during this time? Or do you think there's more of a challenge with some of the pushback on people maybe wanting someone to come into their home?
Let's take COVID out for a second, then I'll overlay COVID. In a non-COVID world, our application is geared 100% towards driving the most efficient, effective workforce that is going out into the homes. I mean, that's the way the care is delivered in the overwhelming majority of our customers. There's some inpatient consideration, but for purposes of this conversation, almost exclusively all the work is delivered in a patient's home. That's under normal circumstances. We've been a great partner with Samsung, and the devices you bring forward are the ones that these caregivers take into the home and give them that mobility to be able to work in very difficult environments in a home. Sometimes no internet, sometimes no connection. Sometimes they're in the middle of a city, but they still can't get internet. So your devices and the ability for our application to work in an offline mode and then synchronize when we get network connectivity is a blessing. And the form factors that you guys provide are helpful because they can slip into a lab coat or into a satchel or something and be very inconspicuous as opposed to a traditional big bulky laptop that maybe doesn't have great battery power or quite frankly requires a place to put down in the patient's home, and you can't always do that. So that said, the combination of Samsung and Homecare Homebase, I think, have always driven a high degree of efficiency and effectiveness. Now you overlay COVID and it's a whole different set of circumstances. All that effectiveness is still there, but now you're struggling, right? Because you can't get in the home anymore in some cases. So what I'm seeing, which is pretty creative, is a couple dimensions. We've got customers who are moving some of their visits to virtual, and so they're using Zoom or Microsoft Teams or any number of third-party partners that they can create these virtual visits for, and they're still using Homecare Homebase. So the nurse may not necessarily leave their home, but they're using their Samsung tablet with Homecare Homebase to be able to document that visit just like they would if they were in person. The only thing that they clearly can't do are things that require physical, actual hands-on, like wound care kinds of things. We've got other customers that are being creative where they're kind of doing a hybrid model where they'll the nurse will, or the therapist will sit in the driveway of the patient's home. They'll do a virtual visit in the car. So they might call in using, again, a Zoom call on the tablet device. They'll do as much of the visit that they can virtually from their car. They'll wrap it up. Then they'll go in the home for that final piece of, let me just get in there, I'll change your wounds, I'll take vitals, and I'll get out. So my exposure is, instead of being there for an entire hour, hour and a half, I'm only there for maybe 15, 20 minutes. So that mobility of that device gives them tremendous flexibility to be creative in the face of COVID.
What do you think will happen next? Will these virtual visits become more common, or do you think there's going to be a rebalance once this is, quote unquote, over?
The short answer is I think to a large degree is going to depend. In home health, specifically in the hospice world, there are legislative requirements that prohibit virtual visits from being used as a means for reimbursement. So unlike a telemedicine or a virtual visit that you may have with your primary care physician or perhaps even with a hospital, and there are mechanisms for reimbursing for those don't exist in the home health and hospice world. So it's difficult to make an economic model because there are situations where it is a severe economic penalty for the home health agency to use a virtual visit in place of a physical visit, even though they're providing good care, doing the same thing, even getting maybe perhaps the same outcomes, but their reimbursement would be substantially different because virtual visits are not reimbursable. So there's some legislative changes that need to happen. And I think that the climate is good. I think CMS has been very, very friendly towards this and has done a nice job of articulating it. But this is a legislative issue, not a regulatory issue. And so there has to be some law changed to allow CMS to begin to reimburse for these. So there's that aspect. On the other hand, though, I think the genie is out of the bottle, so to speak, in that the acceptability of these virtual visits is higher than it ever has been. So I think you've got two things that are kind of at a conflict. You've got patients who are seeing that this is kind of a good technology. It's less burdensome on them, less time consuming. And then I think you've got to figure out the reimbursement model through some legislation, which hopefully will be forthcoming. And then I think it will really be a boon in the home health and hospice. Now that said, I don't think it'll ever be a pure virtual. There are just parts of healthcare where someone referred to it today on a different call that I was on. One of our customers referred to it as a continuum of low touch to high touch. And so there are going to be patients who are recovering from wounds and so forth, or physical therapy, where you're going to need somebody to come out and do very specific things that require a visit.
What's working really well as you expected, and what have you learned and what you would have done differently, given what's happened? So what's working, what's not working?
So I think what worked really well was we really didn't anticipate the flexibility in the application was going to be so valuable. So for example, our customers were able to develop CDC screening guidelines and reporting dashboards and so forth with pretty much off-the-shelf, out-of-the-box capabilities with our product, which was incredibly helpful for them to manage populations of COVID patients. The most challenging, difficult thing was there was so much uncertainty and changing information early on across the spectrum that it made it really hard for us to know what investments to make in the product. And honestly, even though CMS was well-meaning and I 100% support what they did, they relaxed a lot of regulatory constraints, and they made some emergency changes and considerations. That was hard for us because we pride ourselves on being a highly compliant system. And so when you take an enterprise piece of software that is tuned to ensure that you can comply with federal laws, and all those laws got to get waived overnight, we did have to scramble a bit to kind of figure out, okay, so things that did not used to be optional or were required and would hold up billing or so forth, we now need to very quickly release some changes so that people can, while the public health emergency is in effect, be able to not be required.
What are some of the changes you think are going to happen? What do you expect to be seeing as we sort of go into the next year and the year beyond that?
Telemedicine is going to be important, but I don't think that's the major story. When I look out moving forward, what I'm seeing now is for the first time, there's an understanding and an acceptance of what care delivered in the home can provide. So what I think you're going to see is an awareness and an awakening of the role that home health and home hospice can provide. And I think you're going to see a shift in where patients end up when they get discharged from hospitals or when they get referred from, different kinds of events from their providers. And I think that is going to have some interesting ramifications for the cost that's spent on patients, because all the studies show how it is cheaper in home health than any other setting. And I think you're going to start to see higher and higher acuity patients being taken care of in the home. And then lastly, I think you'll find that we may end up almost coming full circle to where the acuity is high enough now that you're going to want nurse practitioners and physicians visiting patients in their home as opposed to having them come in the office. And they may find that it's actually still cheaper and provides better outcomes. I'm starting to see those models emerge as well.
So your outlook is positive. There's more to do. There's a shift, and this shift will play in your favor. That's your outlook.
I believe strongly, yes.
No, that's really good. No, I really appreciate it.
No, I appreciate it very much.
You have been listening to The Future State of Business, presented by Samsung Insights. Thanks again to Neal Reizer from Homecare Homebase for joining us. To learn more, visit the links in the episode description. If you enjoyed the show, please consider subscribing and leaving a review. You can also follow us on Twitter at Samsung Biz USA and on LinkedIn at Samsung Electronics America to find out more about upcoming episodes.